Join me today as I dive into the major update made for the NMC OSCE examination last July. I will break down everything you need to know in this video. So if you are someone preparing for your OSCE examination, then stay tuned to the end of this video. If you are excited about this video, then click the like button so a lot of people will get to watch it. If today is your first time on the channel, my name is Bright Seram Agbenyo. On this channel, I talk about personal finance, personal development, entrepreneurship, career growth, nursing, and migration. If any of these topics interest you, then subscribe to the channel so you don't miss any major update or any new video from me. So let's dive into today's video. As you may already know, the NMC OSCE examination, or the Objective Structured Clinical Examination, is a major step in the process of relocating to UK to practice as an overseas trained nurse. This examination assesses your clinical skills to ascertain that you'll be able to work as a nurse in the UK. In other words, this examination assesses you at the level of a new qualified nurse in the UK. This exam can be challenging depending on your level of preparation. It assesses your clinical knowledge and skills as applied to direct patient care. In order to keep this examination relevant, reliable, and in accordance with current clinical practices, the NMC undergoes periodic review of the examination, and then based on feedbacks from their candidates and stakeholders, they make updates to the examination. And last July saw a similar review. But wait, what are these new changes made to the OSCE examination? Are they going to be beneficial to the candidate? Is it going to make the examination more difficult or more easier? Wait until you find out in this video. There have been some timing adjustments made to some stations and changes to ANTT, that is Aseptic non-touch technique station, and there are new supporting documents and new guidelines for resit candidates. Timing adjustments. Now, when you take the NMC OSCE examination, there are specified times for all the skills and procedures in the examination. Some of these times has been increased. For instance, when you take fluid balance station, the time used to be 12 minutes, but now it is increased to 14 minutes. When you take midstream urinalysis, the time used to be 8 minutes, but that has been increased to 12 minutes. So it is good news, right? That will give you some more room to demonstrate your skill to the examiner. Now, the next major update is changes to ANTT, that is Aseptic non-touch technique. So previously, when we are doing the ANTT, which is wound dressing, so to say, as part of the procedure, you are supposed to indicate to the examiner which of your hands is going to be considered as a clean hand and which one is going to be an aseptic hand. If you are a nurse and you do wound dressings, then you know what I'm talking about. When we are carrying out wound dressing, after wearing our sterile gloves, we have one hand we consider a sterile hand and one we consider a clean hand. The clean hand most times is your dominant hand. That is what you use to do the cleaning on the patient's body or the wound. And then your non-dominant hand, which is your sterile hand, is what you use to pick swabs and other instruments from the sterile field in order to aid you dress the wound you are dressing. In the OSCE examination, after donning your sterile gloves, you are supposed to indicate to the examiner that this is my clean hand, this is my sterile hand. But that has been removed. You are not required to indicate that to the examiner again, that this is a clean hand, this is an aseptic hand, right? So that has been removed. The next major update is the new guidelines for resit candidates. So previously in the OSCE examination, assuming you write your OSCE and you pass, say, 8 stations, and unfortunately you were not successful in 2 stations, you are required to resit these 2 stations. And when you go back to take this resit examination, you are given the same scenarios as previously, but this time round it's not going to be like that again. When you are going to resit an examination, it is very possible that you'll be given a different scenario, but you will perform the same skill. Let's say you couldn't pass assessment station. When you go to resit assessment station, previously you will be given the same scenario you were given the first time on your first attempt to resit. But it is highly possible that now when you go, you will not get the same scenario even though you will perform the same skill or the same task. I hope that is clear. If you don't understand anything, drop your question in the comment section and I will answer you promptly, alright? So basically, those are the major changes made to the OSCE examination. The timing adjustment, where fluid balance has been increased from 12 minutes to 14 minutes. Midstream urinalysis has been increased from 8 minutes to 12 units. It is worth to note that all supporting documents or preparation materials for the OSCE examination has been updated to reflect these new changes. So if you still have the old materials but you require the new ones, I will leave a link in the description to the NMC website where you can download the new updated supporting materials. When will these new changes be effective? The new changes will start applying from the 9th of September 2024. So if you have your examination before the 9th of September 2024, you could continue to use the old materials because your examination will still be the old one. However, if you are writing your examination on the 9th of September and beyond, you are required to use the new updated materials because that's when these new changes will start applying. I hope this video has been very helpful to you. If you are preparing for your OSCE examination and you need support to prepare effectively to pass in just one sitting, then consider subscribing to this channel. I will leave a link in the description where you can join my premium OSCE preparation group and then have access to my upcoming OSCE masterclass where I'll give you in-depth training on how to prepare for the OSCE examination and pass in one sitting. Thanks for tuning in to watch today's video, and if you have any thoughts on the current or the new OSCE changes, feel free to leave them in the comment section. Let's discuss. If it's a question to put them there and I'll answer them promptly for you. And don't forget to share this video to your friends. Subscribe to the channel, like the video so we can support each other to grow professionally.